This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier, and I welcome you to this special episode of Rural Health Leadership Radio. Today's guest is Kate Hill, Vice President of Clinical Services with the Compliance Team. Welcome to Rural Health Leadership Radio, Kate.
Thanks, Bill. It's an honor to be here today.
Yes, well, it's always an honor to get to talk to you, Kate. Kate is the Vice President of Clinical Services with the Compliance Team. I want to thank you again for being with us here today. So tell us about yourself, Kate. Who is Kate Hill? What's your story?
Oh, boy. Well, I'm not a youngster, so there could be a long story there, but we won't give you all the gory details. I started life out wanting to be a nurse from sixth grade.
Oh, wow.
And that was a long time ago. I got sick and I wound up being in the hospital. In those days, for IV medication, you were in the hospital for the 6 weeks. And I fell in love with what the nurses did. Kind, caring, compassionate folks, and just loved it. So I wanted to do that. I followed them around pushing my ID pole for 6 weeks and never changed my mind. I don't, that's not so common for people to have that decision made for them early in life, but I never wavered from that one.
That's
so wonderful. I went into nursing, went into the Army, did a little of that, went into industry, and then was going to retire when the compliance team called me and said, you know, we really need somebody to bring us into the rural health world. And I said, what is rural health? Because I live in suburban Philadelphia. And I'll tell you what, I've fallen in love with it. And a lot of good reasons, which I'm sure we'll get to.
Yes, absolutely. Well, you've talked a little bit about this, why you chose healthcare as a career at such a young age. I mean, was it because they were helping you so much, or what was it that appealed to you around all those nurses that made you want to be a nurse?
That's a really good question. It's hard to know. I think they were just the greatest bunch of nurses I ever met. The nurses are great people. They can do anything.
Yes. They can even stick needles in little girls' arms and make them want to be like them, right?
Yeah, that's amazing, isn't it?
Yes, it is. Yes, it is. So you mentioned you live in a metropolitan area outside of Philadelphia. Why? You said you fell in love with rural health. What is it about rural health that you find so appealing?
What I find appealing is the folks that work in rural health clinics, which is where I do my work, want to be there. They want to live in these rural communities, raise their families there, and be the healthcare provider in the community. They could drive to a city, make more money, all of that, but that's not what they want. And they're just incredible people.
Yes, I would agree with you on that. Well, Kate, as you know, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. What's your definition of leadership?
Well, there's so many good ones, but I think when it comes down to it, it's remembering that it's not about you or me. It's about the people that work for us, about encouraging them, inspiring and building them up every day to get them to be the best that they can be.
Yes, that's a great definition, but you did scare me when you started that, when you said it starts with remembering, and I'm not as good as a rememberer as I used to be, but no, that's a beautiful definition. Thank you. So can you give us an overview of the compliance team and who the compliance team is and the community that you serve?
Sure. We are a 26-year-old company, actually. Last year we had our 25th anniversary. We are started by a nurse, actually, Sandy Canale, who decided that federal regulations needed to be simplified for people to really put them to use and stay compliant. And she's done a super bang-up job with that. She started in DME, and then they brought me in to do the rural. We also accredit in pharmacy, sleep labs, a few other things. But my role is in the rural health clinic world and now in the patient-centered medical home world, a new addition to our program.
Oh, when did you add that service?
2 years now.
2 years. Okay.
I guess you and I haven't talked about that. Right. And we wrote our program with the patients, with the rural health clinic in mind, because it is simplified. That's Sandy's middle name, Simplify. Make it so you can keep compliant. It's not so complicated you have to figure it out every day.
Okay, excellent. Thank you for that overview. So the COVID-19 pandemic has turned everybody's world upside down, right? How has it
Right.
impacted you and your business and your clients?
Well, ironically, we've gotten so busy. Of
Really?
course, I have COVID-19 in terms of pounds, I think, and maybe not quite that many, but it's been challenging to sit at this kitchen table for
Yes.
some 3 months now. But
Yes.
a lot of Zoom meetings and whatnot, a lot of talking on the phone, no travel, of course. That's been a big change for me. But the irony of it is we're extremely busy. It's turned out that the federal government really helped to say, all right, you don't have to pay to do an 855. We're going to waive that $600 fee, and we're going to push these numbers through. So we got really, really busy in terms of doing surveys. Now, they're remote at this point,
Yes.
but that'll change very soon here. We still have to go back and see all those folks that we accredited remotely, but it turned out to be quite a good process.
Excellent. So, is there any forecast of that slowing down, or is it going to continue to be very
Well,
busy for quite some time?
we certainly hope it doesn't slow down. That's what we do.
All right. So, for you and your company, you said that you don't the company does more than just rural health clinics, but that's your area of focus. So what is so unique about rural health clinics that requires a company like the compliance team?
Well, so they can wait. So they have to be certified, and CMS is the only people that certify. To get that done, you either go to the state or one of two organizations. Of course, we're one. And if you get accredited on the way to certification, it's just a higher level and a lot more support. So we offer a lot of support to our clinics to get the job done.
Okay.
So it involves some training, some teaching, and then a survey.
All right. So if, let's say, a CEO or administrator of a rural health clinic thinks, okay, you know what, I need to bring somebody from the outside in to help us with accreditation. What are the top 3 things that he or she needs to really look at when they're making that decision and choosing an outside provider?
Ironically, for us, as I see it, the most important thing is being responsive. Our clinics can call, they have my cell phone, they can call any one of us up, ask a question, we're going to work with them. We're always available, and that is so important. That really isn't going to happen if the state is doing your work with you. They can't. I mean, that's just not how that works.
Right.
But we pride ourselves in that. We get back to people quickly. We have answers for them where we can, of course, or direct them to where they can find the answer. And I would say value for the money. It's obviously you have to pay for that service, and you want to give them really good value for their dollar. They don't have lots of dollars in rural, as we know, and so the value for the dollar is really, really important. And then being trustworthy, doing what you say you're going to do, and
Okay.
that's critically important. And in a timely fashion. That's 4. Sorry.
Okay. No worries. That's good. Good to know. So, you've worked with a lot of rural health clinics around the country. I mean, everybody knows you, Kate, and you're very highly regarded in the industry. What are some of the best practices that you've seen leaders in the rural health clinics that you worked with that they've embraced? Best practices that are worth talking about to share with other rural healthcare leaders?
I think involving the whole team, not just top management, but involve everybody in the clinic.
Okay.
And that's good managers that do that. And they really embrace it. We'll do some calls with them. Everybody gets to ask their question and know the why of why we have to do this. Yes,
Sure.
It's a federal regulation, but there's reasons behind it for good quality care. The bottom line, it's always about the patient
Right.
and providing the best care we can for the patient while maintaining compliance, obviously.
Okay. Yeah, that's great. Good. Makes sense. Can you tell us about one of your clients that you've worked with, that how the compliance team really benefited them? A story about one of your top clients?
Let me tell you about OCH in Missouri. We're working with them on about, I think close to 14 clinics. And they are top organization. And they've come to us for rural health clinic accreditation as well as for patient-centered medical homes. And the comment was they learned more in the training time with us than they learned in the last years for patient-centered medical home. And that's really saying a lot because it's all about the patient. It isn't about reams of data. It's about the patient and how we surround that patient. And they're just a crackerjack organization in Southwest Missouri.
Excellent. That's good to know. Thank you for sharing that with us. So, Kate, when you think about the future of rural healthcare, what scares you the most?
Well, them being there,
Yeah.
particularly the hospital. We all know if the hospital's not there, the town just falls apart. And lack of care for people where 2 hours away is way too far for some injuries or a heart attack or whatnot.
Right,
that scares me the most. We have to figure out a way to sustain them. And I know NRHA is doing a wonderful job trying to do that, but it's a little tough to get some things done in Washington, D.C., and I'm not going to go beyond that statement.
Right. Thank you.
And that's important.
Absolutely.
20% of the population that need care,
Yes.
that need to be cared for. That scares me the most, I think.
Yes. Well, let me flip that question around for you. What excites you the most about the future of rural health?
Oh, the quality of the care. You take a clinic in the middle of nowhere, USA, with a nurse practitioner running that clinic, and it is exemplary. They do everything they can to provide the best care for their patients. That excites me.
Yes, that is very exciting because I would agree with you. The quality because of the people makes all the difference. Well, Kate, it's been a rather quick conversation here today, but we covered a lot of territory. If our listeners only take one thing, one nugget away from this conversation today, what should it be?
Oh, boy. Let's have about a Ronald Reagan quote. And I wrote this one down earlier. There's no limit to what you can accomplish if you don't care who gets the credit. How about that?
I love that. I love that. Kate Hill, Vice President of Clinical Services with the Compliance Team. Thank you so much for being here today and sharing your knowledge and expertise with us.
Thank you, Bill.
If you'd like to connect with Kate or the compliance team, you can check the notes below this video here, and then we'll have their website and information down there. You can also reach out to me if all else fails, and I'll be glad to connect you with Kate as well as the compliance team. If you'd like to learn more about Rural Health Leadership Radio, hey, if you've got a smartphone, guess what? There's a podcast app on there, and search for Rural Health Leadership Radio, and you can be a new subscriber, or you can always check out our website at rhlradio.com. If you enjoyed this special episode of Rural Health Leadership Radio and the things that Kate was talking about and the things that the compliance team might be able to do for you, share this with others that might benefit from it as well, because we are all here to serve you, to help you serve your patients. Until next time, let's keep working to improve rural health, one conversation at a time.